psychiatrist. He's been facilitating these educational sessions in collaboration with Mary Biddle with the YMCA. This is a wonderful collaboration between the YMCA Saint Alphonsus and the Idaho Department of Health and Welfare. We're so grateful to get to have this project occurring throughout the entire year of 2025, and are looking to continue this project in the future years and grow and add additional components to this project as we find funding. So, but the important part is that we're here gathered today to learn together about dementia prevention. Mary shares this quote, "Education is learning what you didn't even know you didn't know," which is a wonderful quote about the value of education for sure. How to access today's and previous HOPE presentations can be found through this QR code in this website. So if you've missed previous presentations and want to view them, you can find them here. They are all recorded and stored here. So feel free to share them with others as well. This is meant to be community education, free for everyone. Spread the word. With that, I want to introduce, I'm going to stop sharing and introduce my wonderful colleague, Brittany Guthrie. She is a PA who has worked at the Neurology department with Saint Alphonsus for many years. She's a member of our Memory Center, focuses on dementia care, but has other areas of neurology-related care as well, and I'll have her introduce herself further.
Hi, everybody. Like Dr. Kuntz said, my name is Brittany Guthrie. I'm a physician assistant at Saint Alphonsus Outpatient Neurology Clinic. I have been a PA since 2015, and I've been in neurology specifically since 2018. And I've been here at St. Al since 2020. I'm originally from Texas, and that's where I moved from. My primary patient basis that I see in clinic is memory loss, dementia patients, post-stroke follow-ups from the hospital, and headache patients. So today, the primary focus is going to be on stroke prevention. Just because, what we do know is people that have had a stroke are at an increased risk of developing, dementia, down the road, and we can see memory trouble after a stroke. So I just want to go over some stroke prevention with you guys. And I do have a little question slide at the end, but you can always ask me a question during the process or during the presentation.
Probably the easiest way to ask a question during the presentation is you can just either unmute yourself and speak up, or you can use the raise hand button at the top so Brittany can see that and call on you. Otherwise, it can be hard to tell that you have a question. So those two ways, just speak up or click the little raise hand button along the top. And with that, Brittany, go ahead and share your screen.
Okay, thank you, Dr. Kuntz, for that clarification. All right, let me see if I can get this.
Yeah.
Okay. Oh, sorry. Okay, can you see the stroke prevention PowerPoint?
Yes, we can.
Okay. Alrighty, let me just get this. Alrighty.
Yep,
okay, so just some learning objectives today. So I'm just going to go over the definition of a TIA, or what most people think of as a mini stroke, and a stroke, go over some risk factors of strokes and TIAs, some typical signs, diagnosis, stroke treatment. I'm going to barely touch on this, and then managing those risk factors at the end or towards the end. So just a few stroke facts. Every year, more than almost 800,000 people in the US have a stroke. And every 40 seconds, someone in the US has had a stroke. And out of those 795,000 people, 610,000 are first or new strokes. And 1 in 4 of those people are people that have had a previous stroke. Stroke is the leading cause of serious long-term disability and death for Americans. Stroke can occur at any age. I've seen them, in the young population, 20, 30 years old, but the risk does increase as one ages. So we typically do see them, in an older individual, but I have, unfortunately, like I said, seen them in a younger population as well. Okay, so what is a TIA? So a TIA stands for transient ischemic attack. And like I mentioned a few minutes ago, most people think of this as a mini stroke. And I get this question, a lot. What's the difference between a TIA and an actual stroke? So a TIA is a temporary interruption of blood flow to the brain. Symptoms typically last less than 24 hours and they're not permanent. And this typically can be a warning sign that a future stroke is going to occur. But not always. I've had patients that have had a TIA, and it does not mean that they're for sure going to have a stroke, but that's really where managing, those risk factors really come into play. And we'll touch on that in a few minutes. Okay, so what is a stroke? So there are two different types of strokes. The first one being a stroke called an ischemic stroke. And this is caused by a blockage of an artery in the brain. It sometimes can be a vein, but most of the time it is related to an artery, which leads to impaired blood flow to that area of the brain. This accounts for 87% of strokes. There are two different types of these ischemic strokes, a type called thrombotic, which is where a blood vessel, a blood clot forms in one of the blood vessels inside of a brain, causing that lack of blood flow to that area. And then another type called an embolic stroke, ischemic stroke. So this is when a blood clot or plaque develops elsewhere in the body, like the heart, and that blood clot travels up to the brain, causing that stroke. A stroke, no matter if it's ischemic or hemorrhagic, can cause permanent life, and that's supposed to say lifelong deficits. And a hemorrhagic stroke, so these account for the 13% of strokes are caused by a ruptured blood vessel in the brain. And there is possibility that people's strokes can start as ischemic, so meaning that like lack of blood supply to the brain, and then can progress into a hemorrhagic stroke, into a bleeding stroke. All right, so TIA and stroke risk factors. So there are some, non-modifiable risk factors, and I didn't mention these here, like age, race, et cetera. But then modifiable risk factors, so those are ones that can, be worked on and changed, include high blood pressure, high cholesterol, diabetes, being a smoker, obesity, cardiovascular disease, like atrial fibrillation, illegal drug use. And I put migraine and aura in here, but that there's a caveat to that. So a patient with migraine with aura who uses estrogen containing products, so like birth control or hormone replacement, can be at an increased risk of a blood clot and a stroke. And then heavy alcohol use and sleep apnea. These are all, potentially modifiable risk factors that can be addressed to reduce risk of stroke. And then I'll touch on this a little bit more in a few minutes. All right, so typical signs of stroke. So most people, think of stroke symptoms just as one-sided, facial drooping, arm or leg weakness or numbness. And yes, those are definitely, signs of a stroke. But there are other ones that as well. So once again, one-sided facial drooping and or sensory changes. So those sensory changes can include numbness, tingling, sometimes even like a burning type sensation, arm and or leg weakness and or sensory changes. So that's numbness, tingling, burning, sudden vision changes, including vision loss or double vision, extreme dizziness. And I'm going to backtrack. So one thing to keep in mind about a stroke is each part of the brain, is responsible for a different function of the body. So a stroke can happen, in different areas in the brain. So when, just an example, a stroke occurs in an area called the cerebellum, which lies in the back of the brain. That can cause extreme dizziness. So I've had patients that have had a cerebellar stroke, and their only symptoms was sudden extreme dizziness, where they can't walk straight. So that can be a sign as well. Speech changes, so that can be slurred speech. That can be when you're speaking, just the words aren't flowing correctly. It just doesn't make much sense. Sudden confusion, and then severe headache, typically referred to as the worst headache you've ever experienced your whole life, something called a thunderclap headache. So these can all be signs of a TIA or a stroke. And then there is a acronym called the FAST acronym. A lot of people are familiar with this. And it stands for, so the F stands for, if you notice any face drooping. A stands for any arm weakness. S is speech problems. The T is time to call 911. But like I mentioned on the previous slide, these are not the only symptoms of a stroke. So just something to be, cognizant of, if all of a sudden there's those sudden changes, like I mentioned in the slide prior, call 911, get to the hospital. Timing is very important in a stroke. So the sooner you get to the hospital, the better the potential outcomes are. So always, if there is ever any concern, please call 911 and get to the hospital immediately. So stroke diagnosis. Once again, if you or someone else is ever concerned you are having a TIA or a stroke, get to the hospital immediately. Typically, tests that are completed once you get to the ER, they're going to look at the blood vessels of the head and neck. So that's something called a CTA of the head and neck. And that's going to look at to see if there's any occlusion. So that's like a blockage in the artery. If there's any broken blood vessels, something called a dissection. And it also looks at to see if you have a lot of plaque buildup or narrowing in your arteries due to that plaque buildup. And then an MRI of the brain is typically performed if able to. A lot of times people that have some kind of metal in their body or they have an older pacemaker are not able to do an MRI of the brain. But that is something that is also completed to see if you've had a stroke. An echocardiogram is an ultrasound of the heart. And what we're looking for when an echocardiogram is done is something called a patent foramen ovale. And this is something people are typically born with, but it increases risk of throwing a blood clot, causing strokes. So we usually get this test done to evaluate. A heart monitor, that is something typically, depending on what the situation looks like, it's a monitor that you wear from anywhere from 2 weeks to a month to check your heart rhythm, to make sure there is no abnormal heart rhythm, something called atrial fibrillation specifically. If there is, that increases risk of stroke, and because it can throw a blood clot, the heart can throw a blood clot that leads up to the brain. And then blood work. This all depends on the situation in terms of these tests that are ordered, but an ER physician, an inpatient, neurologist or inpatient physician in the hospital will, direct that diagnosis. So stroke treatment, like I said, I'm not going to go over this, a lot. I just put in here, it will depend on the cause, just depending, what what the workup looks like in the hospital. So I'm not going to really touch on this too much. Any questions so far? Alrighty, so the main reason we're here today is to talk about those stroke risk factors. So like I mentioned, early on in the PowerPoint presentation, there are some non-modifiable risk factors, so meaning things that you can't control, like your age and your race, family history, those things, you can't control. But there are things that you can control in everyday life to hopefully help, reduce your risk of having a mini stroke and or a stroke. So the first one being is high blood pressure. So ways to manage, high blood pressure can be, and these, and it depends on the person's situation for each of these, of course. And I do always recommend, discussing this with your primary care physician or your cardiologist if you have one. But ways to help manage high blood pressure can be through medications, a lower salt diet. So a higher salt intake can lead to a higher blood pressure. Caffeine moderation. Caffeine causes blood pressure to go up. So I always encourage, making sure you're not overdoing the caffeine, a healthy weight, and then managing stress where you can. And next would be high cholesterol. So once again, medication is an option, but also following a healthier, varied diet. I really like suggesting the Mediterranean style diet. So what that is it's more, lean meats. So meats like chicken, turkey meat instead of red meat, fish like salmon, tilapia, cod, fruits, vegetable based, olive oil based versus, vegetable oil. So trying not to eat a lot of red meat, carbs, sugars, higher cholesterol foods. I'm not saying you necessarily have to cut all that stuff out, but moderation is key when it comes to this. And people can get their blood pressure and cholesterol better controlled with, eating habit changes. So just something to, keep in mind. And then of course, exercising. And diabetes. So diabetes is an elevated blood sugar. And some people, there's two types of diabetes, type 1 diabetes and type 2 diabetes. Type 2 diabetes is usually developed, once you're an adult. And ways to help manage that is, once again, you can do it through diet. So the big things that can contribute to a higher blood sugar level is carbohydrates and sugar in your diet. So I recommend, making sure you're having less carbs and less sugars. Once again, moderation is key for this. Physical exercise can be very beneficial for your blood sugar. And then once again, medication is sometimes an option for people. Being a smoker. So smoking causes inflammation throughout the blood vessels through your whole body. So it increases risk of having a stroke. When I have patients that have had a stroke or a TIA, I always recommend to stop smoking because it does increase that risk. So ways to stop smoking, some people do it cold turkey, although that's usually a little bit harder. But there are over-the-counter options out there like gum, lozenges, and there are prescription medications as well that can help people stop smoking. Once again, I always encourage discussing with your primary care physician if you want to discuss those other options as well. Okay. So, and some other risk factors. So, obesity, so that's, being overweight. That does, once again, it does increase risk of TIA and stroke. So, we go back to this a lot. Eating healthier and physical exercise is very important. So, want to try to, if there is overweight or obese, trying to lose that weight to reduce those risk factors, because obesity is tied to high blood pressure, high cholesterol, diabetes, among other things, therefore increasing your risk of stroke. Cardiovascular risk factors. So there's one that really sticks out is something called atrial fibrillation. And I mentioned this earlier. This is an abnormal heart rhythm. And usually this is managed through cardiology and primaries. Some primaries do manage that as well. So making sure that risk factor is well managed, because if atrial fibrillation is uncontrolled, that can, once again, cause the blood clot to be released, increasing risk of stroke. Heavy alcohol use. So limiting alcohol use. Really, no alcohol is best, but if you were to drink alcohol, just, trying to limit that as much as possible, because that can also increase your risk. So, and then lastly, sleep apnea. So there are several different types of sleep apnea, something called obstructive sleep apnea and central sleep apnea. So obstructive sleep apnea is usually a structural cause. It can be, it can be in the like the back of the throat that causes issues with you sleeping at night. But it's essentially where your brain and other parts of the body, where there's a lack of oxygen to those areas at night. And it in ways so first off, how you're typically diagnosed with that is by doing something called a sleep study, where they watch you or they track your oxygen at night, see if there's any what's called apneic episodes while you're sleeping. And if you are positive for sleep apnea, some treatments typically for that include something called a CPAP machine. It's a device that delivers oxygen air. And then sometimes people strictly just use oxygen. And then also weight loss can be very beneficial for people with sleep apnea. I've had patients that, have lost weight and no longer have sleep apnea. So something, once again, going back to like physical exercise and healthier eating can really help a lot with these risk factors regarding a stroke. So that's really what I have for you guys today. I apologize if I raced through that. But do you guys have any specific questions, any concerns?
Thanks for that great talk, Brittany. Looks like we have a question from Sue. Go for it.